And joining us now is Elsie Godwin, who is a media personality, content creator, influencer, marketing strategist, as well as a blogger, to discuss this week's trending stories at a glance. Well, we start with our very first pick, which is to do with the mixed reactions as WhatsApp rolls out its own status feature. Well, on Wednesday, users on the Facebook-owned popular instant messaging platform WhatsApp woke up to a new feature on the app. Well, a status update. Well, this feature comes in a bid to own their narrative, promote a commitment to privacy, and address users' concerns about impending privacy breach. Well, it started the update notifying users that WhatsApp is now on status. Well, the medium will be used to let users know about new features and updates. It also reiterated commitment to privacy, stating that it cannot read or listen to your personal conversations as they are end-to-end encrypted. Status messages disappeared after 24 hours, and of course, a feature made popular by Snapchat and now available on other social apps like Twitter, LinkedIn, Facebook, and Instagram.
Okay, so what's your perception of this particular story and how have people responded to it?
Thank you for having me. I mean, if you recall, about 3 weeks ago, we had an outrage on social media, which is basically because of a change in the data policy sharing of WhatsApp, which people interpreted to meaning that WhatsApp is now being forced to share data, our own personal data, with Facebook. And the company has come out to say that this is not the case. However, that perception caused a rival platform, which is known as Signal, to get about 4,200% increase in their downloads as people were looking for alternatives. Now, this feature is basically for WhatsApp to be able to say, you know what, we are here for you. We want to break down these messages for you to understand what we are saying so that our message will not be misconstrued. But of course, social media will always be social media, and you got reactions of people insinuating that the fact that WhatsApp can actually become something visible on their status means that there is no privacy in terms of our understanding. Basically, that before you can be able to see somebody's WhatsApp status, it means that the person has saved your number and you have as well saved the person's number. So there's a mutual agreement to be able to view this. However, I think that's where we're getting it wrong. Because it feels like when you go on an Arise television website, you know, and Arise decides to say that when anybody comes on our website, there's going to be a feature on a particular area that would help us share a message. They can update it and they can put that in there without necessarily having your details or your contact or your mobile number to be able to do that. And that's just what it is. We've seen that on Instagram, Facebook, and especially on Instagram. When there's a new feature, it comes up. So I think we need to begin to understand it. And of course, WhatsApp is just trying to maintain that level of trust and regain the trust. Because when it comes to Facebook, the issue of data mining has always been a problem.
The second story, which we've got here, it says that Bill Gates advises Nigerian government to invest in healthcare, not COVID-19 vaccines. So this second story on our radar for the week here is on the health sector and our focus on COVID-19 vaccines. American business magnate, philanthropist, and co-founder of the Bill and Melinda Gates Foundation, Bill Gates, has said that Nigeria needs to prioritize the development of its health sector over COVID-19 vaccine. He said this to journalists, and he said specifically Nigeria should not divert the very limited money that it has for health into trying to pay a high price for COVID-19 vaccine. So what is the thought about this?
This one is another very interesting story, and watching the conversation go on social media is an actually interesting one, because it begins to show the level of distrust that the Nigerian citizens, of course, have for their government. Many people agree with Bill Gates. The death toll coming from COVID-19 is about 1,547. Now, one life is important. However, if you begin to put that side by side when it comes to malaria, at 2019, globally, over 400,000 lives was lost to malaria, and Nigeria accounted for 23% of that 400,000. That's almost 100,000. So it tells you that we had a pandemic before this pandemic. Our primary healthcare system needs to be revamped. So yes, we want the vaccine, but however, we also know that our healthcare system needs help. Would it be a good decision to say we don't need the vaccine now? It's left for the government to decide, but we really understand where he's coming from. A lot of people agree that our healthcare system needs help. And let's see how the decision will go, really.
And see how the decision is, because let's not forget that we're in the midst of a global pandemic and vaccines is quite important. Yes, the points that you have made in terms of the fact that Nigeria has a high mortality rate from other diseases and viruses should come to mind. But in your opinion, is this one that will be taken seriously, or do you think that it will just end up as just a headline and eventually it fizzes away?
I mean, this is Nigeria, and I wouldn't be surprised if it's just a headline. However, I know that the pandemic has shown our government the need to revamp our healthcare system. How they would get funds for this is what they need to sit down to begin to bring in private sectors and allow investors, create policies that allow investors to play in this field, because we need help. We're talking about our primary healthcare system. We've not even got into the conversation of the secondary healthcare system. A lot needs to be done in terms of even getting the healthcare practitioners to be very comfortable to do their job. We're losing our hands, our best hands, and I'm hoping that this is not just going to be a headline, as much as I cannot sit here to say, you know what, let's not have the vaccine. We also know that Nigeria is one of the countries that are going to key into the vaccine alliance to get free vaccine, as we are, of course, known to be one of the poor countries. However, the vaccine is important, the healthcare system is important. I strongly hope that this will not be just a headline for us all.
Well, by the way, the COVAX, that's the Vaccine Alliance, there is a contribution that every country is meant to actually make, you know, to procure those vaccines. But I would have to say thank you so much to you, Elsie Godwin, for joining us tonight and, of course, breaking down all those big stories that trended during the course of the week.